Good evening to all of you. Screen is visible. Anybody's screen is visible. Just a second. Okay, now it is visible, I think. Okay, already we have discussed about your diabetes. Okay, so it is a metabolic disorders mainly related to your pancreas. So pancreas is mainly responsible for secretion of insulin. Okay. So if the insulin is not able to maintain the metabolism or metabolic process of glucose, then glucose level will be increased in your blood. Okay, so that is otherwise called hyperglycemia. This increase in glucose level of the blood. So you have to maintain the glucose level by using some healthy diets, or if it is not controlled by healthy diet or exercise, you can go for treatment. So you can go for anti-diabetic drugs, or you can use direct insulin preparation so that your blood glucose level can be maintained. It is audible and visible.
Yes, sir.
Okay. So these things we have already discussed. Just to remind you, I am going again. So we'll go one by one. So all these things I have discussed. So it is again two types: diabetes type 1, type 2. First one is insulin dependent, second one is non-insulin dependent. And during pregnancy or gestational period, you may have some diabetes with mother. Okay, that is called gestational diabetes mellitus. Okay, so by this, why it is diabetes is mainly occur due to the damage or destroy of the beta cells. How beta cell is damaged? Due to some autoimmune disorders. Okay, so this is again two types: insulin dependent, insulin non-insulin dependent. So insulin dependent mainly occurs in case of childhood stage. Okay, but your non-insulin dependent, that is mainly in adult stage. Okay, or in the old stage. Okay, so these are the difference I have already discussed. How the beta cells are producing the insulin. Beta cell of pancreas produce insulin, but if glucose level is more, they are unable to cross the cells, so that the glucose will be more inside the blood, so that you are unable to control the glucose level by the pancreas, because already the beta cell is damaged. They are unable to secrete the insulin properly. So these are the causes. What are the different causes? Maybe genetic factors, some pancreatic disorders, overweight, stress, medicine, some other medications also can cause diabetes. So these are some of the signs and symptoms. You may have frequent urination, some spots on the hands, fatigue, you will feel tired, increase in the thirst, hungry, you feel hungry, some healing process will be very slow, vision will be very difficult, and weight loss. So then only you can go for treatment. Okay. So these are the diagnostic criteria. So generally you are fasting blood sugar less than 100. If it is more than 100 to 125, we will call it pre-diabetic stage. If it is more than 126, it is diabetes. So based on this, you have to decide the treatment. Okay. So after food also, you have more level of blood glucose level. So based on that, you have to decide. So these are already told you how the insulin. So this is the insulin preparation. So first you try the treatment of diabetes with anti-diabetic drugs. If anti-diabetic drugs fails, then you can use the insulin. So this is the treatment criteria for diabetes. So don't use insulin directly on the first stage or in normal initial stage. Okay, but as per your syllabus, it is given first. That's why I have discussed insulin. Okay, so there are different types of insulins. How they are produced already discussed. Okay, so there are 51 amino acids present in your insulin. So one is one part chain A and chain B. Chain A is having 21, chain B is having 30. So total is 51. Okay, how they are linked by disulfide linkage or disulfide bond. Okay, so already discussed. So one part is amino group, another is carboxylic acid group because it is the polypeptide of amino acids. Okay, so depending on their different properties, they are different categorized: fast acting, short acting, long acting, intermediate acting. Depending on their duration of actions, they are different types. Okay, so these are already discussed. You can go through the material already. I have sent you in morning time, so you read thoroughly those things. So depending on the duration, onset of actions, I have given classifications. You read from the table. So here are the different type of insulins. How to prepare the insulin? So what are the different source of insulin? So from pork you can get the insulin, but these are antigenic. Means they cause some antigen antibody reactions. Okay. So now you are going for some highly purified insulins. These are less antigenic. Means they are not producing any antigen antibody reactions. They can easily administer. Okay, because these are more purified form. So that nowadays recombinant DNA technology is mostly used to prepare the purified form of insulins. Okay, so these are different marketed products depending on their duration of actions. So you can go through the material. Any doubts you can ask me. Then we will go for anti-diabetic drugs. So these are different type of insulin preparations. So these things I have already discussed. So there are some reactions that is called lipodystrophy. If we will administer the insulin on particular site on the skin, they will cause some reactions that is called lipodystrophy. That is the local reactions. If you are injected on same site repeatedly, it will cause lipodystrophy. Okay. So these are some of the. So this is the fate of insulin, how the insulin is metabolized. So it may be metabolized or degraded in the GIT system if it is given orally, but it is not given orally, it is given through the intramuscular route. So that it is metabolized in liver. Okay, the plasma half-life is 5 to 9 minutes. Okay, so within 5 to 9 minutes, it will give the action. So these are all about your diabetes, different types of diabetes and different types of insulin preparations and how the insulin preparation is used. What are the onset of action? What is the duration of action? Everything. What is the metabolism of insulin? All these things we have discussed in previous class. So now we'll go for anti-diabetic drugs. Okay. So this is all about your anti-diabetic drugs. Just a second. Okay. So what is diabetes? Already you have cleared. So it is a metabolic disorder. So you have to treat the diabetes by using some anti-diabetic drugs. So you have preference with insulin or anti-diabetic drugs. So these are different derivatives. One is sulfonyl urea derivatives. Sulfonyl urea derivatives. Depending on the chemical structure, they are different categorized. One is biguanides. Okay. and thiazolidine dione derivatives, and some amylin analogs, and alpha glucosidase inhibitors. So depending on the mechanism of actions, there are different types. Okay. So different anti-diabetic drugs, they have different mechanism of actions. On different sites, they are acting and producing their anti-diabetic activities. So one by one, we'll discuss. So you see the classification. So anti-diabetic drugs are the drugs used to treat diabetes mellitus by altering the glucose level in blood. Means you have to decrease the glucose level in blood by these drugs. Okay. So some of the preparations like insulin, exenatide, liraglutide, and pramlinatide. These are the drugs which are given on the external route, means on IV, or you can give through intramuscular like insulin. But some others remaining anti-diabetic drugs are used orally. So most of the anti-diabetic drugs are used orally except these drugs. Except these drugs remaining are administered orally. That's why they are called as oral hypoglycemic agent or oral anti-hyperglycemic agent. Hypo or anti-hyper, same meaning. Okay. So these are otherwise called hypoglycemic agent or anti-hyperglycemic agents. As they are administered through oral route, they are called as oral hypoglycemic agents. Okay. So these are the classifications. So if they have sulfonylurea derivatives, there are two types again. First generation, second generation. Now third generation also coming. So I will give you the examples on next slide. So first generation is tolbutamide, chlorpropamide, chlor, chlorpromamide, chlorpromamide. Okay, tolbutamide, chlorpromamide. Okay, tolbutamide means toluene is there on the side chain, and here instead of toluene means instead of CH3 group you have fluoro group. That's a chlorpromamide. Same structure but modification in the side chain. Next is second generation. Second generation you have the drugs like levenflamide, lipizide, gliclazide, and limpirid. These are the most commonly used, clinically used anti-diabetic drugs. So based on the condition of patients, whether it is the initial stage or intermediate or severe stage, you have to decide the drugs. Then if you go for biguanides, means two guanidine nucleus are merged to produce biguanides. Example is most commonly used drug is metformin. It is also most commonly used chemically available drugs. Okay. Next is meglitinide, another derivative. So you have ripaglinide and metaglinide. Two compounds are there. Two drugs are available on this. Next is thiazolidine dione derivatives. You have rosiglitazone and bioglitazone. These are the insulin sensitizers, otherwise called insulin sensitizer. They'll sensitize the insulin activity. Okay, that's why they are called as insulin sensitizer. Another is alpha glucosidase inhibitors. These are examples agarbots and niclitol. These are two examples of alpha glucosidase inhibitors. These are mainly responsible for metabolism of glucose. Okay. So these are all about your classifications as per your syllabus. Okay. So you can write one by one on the classifications. Okay. So first we'll go for sulfonylurea. What is sulfonylurea? So it is the first anti-diabetic drug discovered in 1942. Okay. So first anti-diabetic drug is orally available drugs. Okay. So it is used in patients with type 2 diabetes mellitus. Means type 2 means non-insulin dependent. Okay. Or in case of obese or not respond to dietary or exercise. If your diet or exercise is not maintaining the blood glucose level, in that case you have to use sulfonylurea derivatives. Okay, so first of all you have to maintain your diet and exercise. If you have pre-diabetic stage, if it is not controlled, then you have to use these medications like sulfonylurea derivatives. Okay, so these are the different sulfonylurea derivatives. This is the common structure for all sulfonylurea derivatives. Sulfonylurea, urea is here. NH2, CONH2 is urea, and sulfur dioxide. So SO2 NH2 means sulfonamide. If SO2 NH2, it is called sulfonylurea. Sulfon group with urea, that is called sulfonylurea. Okay, there are two side chains here, R1 and R. So this is the aryl group or phenyl ring. So here we have side chain R. If it is CH3, that represents toluene. So benzene ring with CH3 is called toluene. That's why the name is given tolutamide. And side chain is 1, 2, 3, 4. So N-butane is there. Okay. 4 carbon. Chloropropamide means if instead of CH3 it is Cl, fluoro group, then the name is chloropropamide. Propamide means again propane is here. Here butamide means butane is here. Okay, so depending on the structure, they have given the name itself. So like this, some other derivatives are available in the market. Tolazamide, acetohexamide, glyburide, glipizide, glimepiride. So these are slowly developed by modification of the parent structures. That is, parent structure is sulfonyl urea. This part is called sulfonyl urea. Okay. So one by one we'll discuss. So this is the general mechanism of all the sulfonylurea derivatives. Okay. So what is the mechanism? Sulfonylurea are insulin secretogives, means they are responsible for stimulating the insulin secretion. Okay. How they are secreting? That act through a specific receptor which is linked to potassium channel on the surface of beta pancreatic cell. Pancreatic cell are beta cells. Okay. So they are mainly triggering the insulin secretion. So this potassium channel here you can see. So this urea is mainly responsible, sulfonylurea. They are mainly triggering the potassium channel. So automatically the insulin will be secreted by the pancreatic cells. So this is the general mechanism for all type of sulfonylurea derivatives. So one by one we'll discuss individual drugs, how they are producing the actions. So first one is your tolbutamide. Tolbutamide. So it is the first generation potassium channel blocker. I told you here, potassium channel is blocked. So automatically what will happen if potassium is blocked? So here calcium channel will be open here. Okay. So if it is open, then they will secrete the pancreatic, or they will activate this beta cell so that insulin is produced or insulin is secreted. So this is the mechanism. So this is the first generation potassium channel blocker, sulfonylurea oral hypoglycemic medication. So as we are used orally, so it is an oral hypoglycemic drug. Okay, this drug is used in the treatment of type 2 diabetes. If the diet is alone not effective, suppose you are using proper diet and not maintaining the glucose level, in that case you have to use tolbutamide. Okay, so tolbutamide stimulates the secretion of insulin by pancreas. So their main role is to stimulate the secretion of insulin. Okay, that term is called insulin secretagogues. Insulin secretagogues. The term used for this one, stimulation of secretion of insulin. Okay, so it will go for the structure sulfonylurea derivative. Okay, here phenyl ring with methyl it is called toluene, otherwise called as toluene. Okay, so if you go for nomenclature, this is sulfonyl urea. This is the parent structure, sulfonyl urea, NH2CN. So 1-butyl, here this part, 1, 2, 3, 4, 1-butyl normal chain, N-butyl structure. That's why 1-butyl, okay, 1, 2, 3. So one position butyl is there, 1, 2, 3. So 3 again you have this part. 4 methyl, 1, 2, 3, 4. So 4 part methyl phenyl. 4 methyl phenyl sulfonyl urea, and one position you have butyl group. So this is the nomenclature, like this you remember. So total parent structure is sulfonyl urea, one position starting from 1 here, so 1 butyl. Again 1, 2, 3. So in 3 part you have this nucleus, 4 methyl phenyl. Okay, totally sulfonyl urea. Like this you remember. So if you go for SR study, so based on the structure, you have to design the SR study. So here, this side chain, here you have phenyl ring. So this phenyl ring, that is the aromatic ring, okay, which is present next to sulfoxide group. This is sulfoxide group. S double bond O double bond is sulfoxide group. And it should be a phenyl ring. Already you have seen the structure. This is phenyl ring, that is aromatic in nature. It is present next to sulfoxide group. Okay, next to sulfoxide group. Why it is required? Because it is required for your lipophilic property of the drug. Lipophilicity of the drug is due to presence of this ring. That is your phenyl ring. Okay. It should have substituent at para position. You can see here, it's substituent at para position, that is fourth position, 4 methyl. So it may be methyl sometimes, some other groups may be attached to produce the hypoglycemic activity. So in your tolbutamide, this is the general I have given for all type of sulfonylurea derivative. I have given there. For your tolbutamide, you write here methyl group. Okay. Then the larger or more complex para substituents comprise the second generation. So in case of this is third generation, this tolbutamide. If in case of second generation, then the substituent is more complex. So that more activity will be there because there is more binding of a drug with receptors. Okay. So if the structure or substituent is more complex this side, then your drug will bind properly with the receptor. Then it will give better activity. This is the meaning. Then R2. Suppose this side also some ring or you have some here as per the structure it is N-butyl group. So if it should be also lipophilic and the size constant with N-methyl is inactive. If methyl is there, then it is inactive. Ethyl group, methyl is inactive. If ethyl is there, CH2CH2 suppose, it is low active. And if it is more also inactive, so you have to maintain from N propyl to N hexyl. Means here you have butyl group. So from propyl to hexyl means 3. Total carbon should be 3 or 6. So 3 to 6 is required for the activity. 3 to 6. Here it is 4, it is okay. Some propyl, second case, suppose here it is propyl, so it is accepted. Okay, it will give some activity. If it is more than that, it will give or it will be inactive. That is N-dodecyl means it is more than 10, suppose. So it is not useful. So up to hexyl group, up to 6 carbon, it is most potent. So 3 carbon, total number of carbon 3 and propyl to N-hexyl. So it is the common SI study for all type of your sulfonylurea derivative. You can write for all type of drugs depending on their structure. What are the side chains? What are the here aryl group, and what are the substituents present on the aryl ring or phenyl ring. So like that you can write. So as per your syllabus, it is given tolutamide synthesis. Okay. So you can take or you can break the structure here, make two compounds, then you can go for synthesis. So this part I'll take. So this is called para-toluene sulfonamide. This part, para-toluene, or you can write para-methyl phenyl. You can write sulfonamide, para-methyl phenyl sulfonamide, or this total is called para-toluene sulfonamide. So if you take sodium salt of this one with one ester, that is called carbamic ester. So this part is suppose ester form, carbamic ester. Okay. So remaining side chain you can like that, you can represent ester form. NHCO, then O ethyl, carbamic ester. Then you go for condensation. So sodium ethoxide will be released here. Sodium ethoxide. This is called sodium ethoxide. So the salt will be released. Then you get the condensation form, that is called tolutamide, and the brand name is called Orinates. Okay, you will get directly NHCO, NH, then your butane, N-butyl. Okay, so this is the general synthesis for your tolutamide. So if you go for mechanism, it lowers the blood glucose level by stimulating the release of insulin from pancreas. Okay, they are responsible for stimulating the insulin by blocking the potassium channels. Okay. Then it is used along with diet and exercise, because sometimes diet and exercise is not helpful for maintaining the glucose level. So that you have to use along with diet and exercise, and sometimes with other medications to treat type 2 diabetes mellitus. With some other derivatives you can use along with tolutamide. So this is all about your tolutamide. And this is the side effects, general side effects like nausea, or you may get some upper abdominal fullness. So you will feel some fullness in your stomach in upper part. Heartburn, rash, skin rashes with a headache, change in the taste. You feel some other different taste. So these are some of the side effects of your tolutamide. Okay. Next we will go for chlorpropamide. Chlorpropamide. You see here only same sulfonyl urea derivative. Here side chain instead of butane it is propane 1, 2, 3, and instead of methyl it is chloro group. Okay. So it is called chlorpropamide. Chlor means chlorine is here, propane means this side, so that's a chlorpropamide. It is a oral hypoglycemic agent, or you can say oral anti-hyperglycemic agent, same used for the treatment of non-insulin dependent diabetes mellitus, or you can say type 2 diabetes mellitus. Okay, it is a long-acting first generation sulfonyl urea. It is acting for long period of time. That's a long-acting. It belongs to sulfonyl urea class of insulin secretor modules, means it is stimulating the insulin secretion. How it is insulating secretion? Which act by stimulating beta cell of pancreas to release the insulin. So they are responsible for stimulating the beta cell of pancreas so that insulin is secreted. So how they are secreting? By blocking the potassium channel. If you block the potassium channel, so the calcium channel will be open. Due to open of the calcium channel, automatically the beta cell will be stimulated. Okay. Then you have secretion of insulin. So this is the process. You can go for your nomenclature or IPS name. So this is sulfonyl urea, your parent structure. Okay. Sulfonyl urea part position 4-chlorophenol. This is 4-chlorophenol. 4-chlorophenol sulfonyl urea or sulfonyl propyl urea. This is propyl. Sulfonyl propyl urea. Total. Sulfonyl propyl urea. Okay. Like this, you can give the name. If you go for the SR studies for this drug, so based on the structure, you can write Presence of aromatic ring next to sulfoxide group. This is your sulfoxide group. Next to this, you have aromatic ring. It should have phenyl. It should be a phenyl, which is responsible for lipophilic property of the drug. So for lipophilicity, you have to maintain this phenyl ring. Presence of electron withdrawing group like chloro group. So here chloro group, it should be present on the ring to enhance the or to potentiate the hypoglycemic activity. So to increase the hypoglycemic activity, it should be a electron withdrawing. Then sulfonylurea and side chain, this part, sulfonylurea and side chain, these are responsible for binding of drug with receptor. So these are responsible for binding. These are responsible for lipophilic property. And this is the responsible for potentiate the activity of the drug. These things you have to write properly in your exam, SAR studies. Okay. Next we'll go for uses. Chlorpropamide is used with proper diet and exercise to control the blood glucose level in case of type 2 diabetes. Okay. Next, common side effects same type, but some different is there. Nausea, vomiting, same. Just common skin rashes will be there. You will feel hungry because glucose level will be decreased, so that you will feel hungry. Sometimes you have weight gain and diarrhea, loss of appetite. You will not feel hungry. So mild hungry will be there. Okay. Next, we will go for another drug. It's called glipizide. Glipizide, otherwise called as glucotrol. It's the brand name of this drug, glucotrol. Okay, so this is the antidiabetic drug of sulfonylurea derivative used for the treatment of type 2 diabetes. Okay, glucotrol, other name of this glipizide. It is a brand name. It was used together with diabetic diet and exercise. So along with your control diet, you have to use this type of drugs. It was patented in 1969, okay, and approved for the medical treatment in 1971. Okay, so first it was patented, then it was used clinically in 1970. It was approved for medical use in United States in 1984. So later in USA, they have approved for the treatment of diabetes. Okay. So it is a short-acting second generation sulfonylurea. You remember. So glipizide is a short-acting second generation. So you remember what is long-acting first generation, short-acting second generation. So like that you remember for your GPAT exams. Okay. So this is your structure, you can remember. So here you have pyrazine nucleus, pyrazine 1, 4, nitrogen is 1, 2, 3, 4. If it is 1 and 3, it is pyrimidine, 6 member with nitrogen at 1, 3 position is pyrimidine. If it is 1, 4, then it is called pyrazine. So pyrazine carboxamide, it is methyl pyrazine. So this is methyl group. Pyrazine, methyl pyrazine 2 carboxamide 1, 2, 3, 4, 5. Okay, 1, 2, 3, 4, 5. So 5 position methyl is there. 5 methyl pyrazine 2 carboxamide, CONH with carboxamide. Next remaining part, what is there? You see here cyclohexyl carbamoyl sulfamoyl. Here this one. Cyclohexyl carbamoyl sulfonyl or sulfamoyl phenyl, then ethyl CH2CH2. CH2CH2 is here ethyl. Okay, this is 5 ethyl pyrazine carboxamide, parent structure support this side, and remaining N position remaining are attached. That side is given N position remaining are. What are the remaining part? Cyclohexyl carbamoyl sulfamoyl phenyl ethyl. This is two carbon is there. So this is the nomenclature for your drug. So what is the mechanism? Same thing, but it is given in different way or different writing. You can explain. So glipizide sensitize the beta cell of pancreatic isolates of Langerhans insulin responses. So in pancreatic cell, there will be isolate of Langerhans which is having beta cell. So that beta cell is sensitized by the glipizide drug. Glipizide acts by blocking the potassium channel among beta cell of pancreatic isolates of Langerhans. So their main role is to block the potassium channel. By blocking the potassium channel, the cell depolarizes. So depolarization takes place by blocking the potassium channel. The opening of calcium channel. I told you already. So the voltage gated calcium channel will be opened. So one channel is blocked and causes depolarization of the cell so that it will result the opening of voltage gated calcium channel. If calcium channel is open, there will be influx of calcium. If calcium is entered inside, then it will encourage the insulin release from beta cell. So this is the general mechanism for all cases. So glipizide is also having same type of mechanism. So their role is to block the potassium channel. If you block the potassium channel, there will be depolarization. So this depolarization of the cell causes opening of the voltage gated calcium channel. If the calcium channel is open, there will be influx. Influx means entry of calcium ions inside the cell. If entry of calcium is there, then it will stimulate the insulin release from the beta cell. So this is the mechanism of these drugs. You can write same mechanism for all other drugs also. If you go for research study, same thing you can explain. So based on the structure, you see presence of aromatic ring. So this is your aromatic ring next to sulfoxide group. This is your sulfoxide group should have phenyl ring. This is your phenyl ring. It is responsible for lipophilic property of the drug. Okay. Presence of heterocyclic ring. So this is your pyrazine ring. Sorry, pyrazine ring. Here you see pyrazine, not pyrimidine. So if it is pyrazine ring, then it is wrongly given. It is pyrazine ring. Enhance the hypoglycemic activity. If it is replaced with pyrimidine ring, it will loses the activity. So this is pyrazine nucleus. It is wrongly given. Okay. Then sulfonylurea with the other side chains like this. Sulfonylurea with the other side chain responsible for binding of drug with receptors. So these things are required for binding site. This is for lipophilicity and this is for increasing the hypoglycemic activity or potential hypoglycemic activity. So these three parts are mainly responsible for the SR study. Okay. So like this you have to remember. Next is this. Glipizide is an oral diabetic medicine which helps to control the blood sugar level by production of insulin from pancreas. The same thing they have written. Glipizide is also used together with diet and exercise to improve blood sugar level in adults with type 2 diabetes mellitus. So along with diet and exercise, you have to use this type of drugs. So general side effects like you have nausea, you have headache, diarrhea, and low blood sugar. Because you are controlling blood sugar, so there will be less level of glucose in the blood. So automatically you will feel some hungry or some other. You can get some sensation on the skin. Then we'll go for glimepiride. Glimepiride. So this is also oral diabetic medicine used together with diet and exercise to improve the blood sugar level in case of adults. It is not used for treating type 1 diabetes. Only for type 2 it is useful. It takes up to 3 hours for maximum effect and lasts for every 1 minute. So to produce its maximum effect, it is taking 3 hours. but continue the activity up to 1 day or 24 hours. So up to 24 hours, it will produce the effect. But for maximum activity, it will give 3 hours, within 3 hours. So it is a long-acting third generation. You remember, it is a long-acting third generation. So it is a third generation glimepiride, okay, and long-acting. Okay, so remember this one. It is a long-acting third generation sulfonylurea derivatives. Okay, we will go for nomenclature. So it is having pyral ring, pyral carboxamide, pyral carboxamide, 5-oxo, 1, 2, 3, 4, 5. This is 5-oxo, pyral carboxamide. Then you have 4-ethyl, 1, 2, 3, 4, 4-ethyl here, 4-ethyl, 3-methyl. Then N position, what is there? 4-methyl cyclohexyl. This is 4-methyl cyclohexyl. This cyclohexyl with 4 position methyl ether. 4-methyl cyclohexyl. Carbamoyl sulfamoyl. This is carbamoyl sulfamoyl. Phenyl ethyl. This is ethyl. CH2. Understood? So pyral 5-oxo, 1, 2, 3, 4, 5. 5-oxo, pyral, 1 carboxamide, 1 position carboxamide, 1, 2, 3, 4, 5. Okay. Here you have 4-ethyl, 4 position ethyl, 3 position methyl, then N position remaining part. Remaining part means 4-methyl cyclohexyl. 4-methyl cyclohexyl, carbamoyl, sulfamoyl, phenyl ethyl. So like this they have designed the nomenclature. So you have to remember and practice. Next we'll go for SR studies. Same thing but they have written in different way. So presence of aromatic ring, this ring next to sulfoxide group should have phenyl ring and is responsible for lipophilic. So always this phenyl ring is responsible for lipophilic property of the rock. Okay. Presence of heterocyclic ring like pyral ring enhance the hypoglycemic activity. So activity will be increased by the presence of this nucleus. Okay, if we replace with the other ring, then it will decrease the activity or losses the activity. Then remaining sulfonylurea and the side chains. These side chains are responsible for binding of drug with receptors. So this part is mainly responsible for binding of drug with receptors. So these are mainly different properties or criteria for a drug to be active towards diabetes. Okay. If we go for mechanism, like all other sulfonylurea, glimepiride is also acting as a insulin secretagogue. Means it is secreting or it is stimulating the insulin secretion. Okay, it lowers the blood sugar level by stimulating the release of insulin by pancreatic beta cell and by inducing the increased activity of intracellular insulin receptors. So they are also stimulating the insulin receptors intracellular so that the insulin secretion will be more and produce good hypoglycemic activity. Okay. So this is the mechanism of this glimepiride. Then you can use with proper diet and exercise to control high blood glucose level in type 2 diabetes. Okay. In case of type 2 diabetes, you can use along with your proper diet and exercise. Okay. These are some of the side effects like your headache, nausea, dizziness, weakness, and weight gain. Okay. So these are the common side effects with all type of your anti-diabetic drugs. Okay. So these are all about your sulfonylurea derivatives. So you should remember what are the first generation long acting, second generation short acting, and third generation long acting. So these things you can remember. Okay, just write disturbance in electricity. Okay, biguanides. Biguanide means two guanidine molecules are merged to produce biguanides, or otherwise called bisguanides. Bis. So one of the example is metformin. Okay, one of the example is metformin. I'll make it full screen. Just a second, power was off. Okay. So it is otherwise called bisguanide or biguanide. So one of the example is your metformin. Okay. So two amide group. Biguanides. Guanides means NH2. If urea is there, it is CO. NH2CO NH2, but it is NH2C double one. In place of O, it is NH. That's why two are merged here. NH2CO NH2 NH2 NH2C double one NH. This is one guanide. This is another guanide molecule. Both are merged here. So here you can see the nomenclature NN dimethyl imidodicarbonimidic diamide. This part is called, this is NN, one N position, two methyl is there. That's a NN dimethyl imido. This type of naming is called imido. C double one NH. Imido. Okay. Dicarbonimidic diamide. Okay. So two amide is there, diamide. Okay. So this class of agent is capable of reducing the sugar absorption from gastrointestinal tract. Okay. So they will reduce the absorption of sugar from GIT, because if it is absorbed, then it will go to the blood circulation. So they will inhibit the absorption of sugar from the GIT tract or gastrointestinal tract. They can decrease glucose. They can decrease the glucose. Okay, the gluconeogenesis, formation of glucose automatically increase glucose of muscles and fats. So if it is uptake by the muscle and automatically. So these are some of the mechanisms of metformin. These are also unable to stimulate the release of insulin from pancreas. So they are not able to stimulate. So this is not the mechanism. Only these are the mechanisms by which they will decrease the glucose level in blood. Okay. So this is called biguanide derivatives. Mechanism decreases hepatic glucose production. So in the liver, some production of glucose will be there, so it will be decreased. Decrease intestinal absorption of glucose. In intestine, absorption of glucose is decreased. Improve insulin sensitivity by peripheral utilization of glucose. In periphery means by the muscles or fat tissues. So they are utilized. So they will improve the insulin sensitivity by increasing the peripheral resistance, peripheral uptake and utilization. So if it is utilized by fat or muscles, then automatically your glucose will be decreased. So these are the mechanism for metformins. Okay, so you can see the diagram. So in molecular level also they are working, they are activating AMP activated protein kinase. So this is a enzyme which will reduce the hepatic glucose production. So they will activate this one, this enzyme. Automatically the glucose production by hepatic cells will be decreased, and then automatically glucose level in blood also decreased. So this is the mechanism for your metformin. So they are mainly activating AMPA, means AMP protein kinase. This is one the enzyme responsible for production of glucose from liver. So if they are activated, automatically it will reduce. Okay. So if we go for SR studies, you should have guanidine group. So this part is guanidine. This is also another guanidine. So these groups are responsible for hypoglycemic activity. If any side chains are there, suppose NN dimethyl group, then it is responsible for binding of drug with receptors. So like this, you will write the essay study of metformin. If you go for uses, it is marketed under the trade name like glucophage. It is a first-line medication for the treatment of type 2 diabetes, particularly in people with overweight. If you have weight more than your body mass index, BMI, as per BMI, if you have higher body weight, then in that case you are using metformin. So this is the specification for the treatment of diabetes. And you have side effects like nausea, vomiting, stomach upset, diarrhea, weakness, and some metallic taste. So these are some of the side effects of this metformin. So these are all about your sulfonylurea derivatives and biguanides. And these are some of the general side effects or adverse effects with examples. So you can remember for your exams. Okay. So any doubts you can ask me, or you can send me through chat box. I will give you any doubt is there. So you have to remember your mechanism, SR study structure, okay, and some specific synthesis of like talbutamide as per your syllabus it is required. You have to remember the synthesis of this drug, okay, and some first generation, what are the examples, second generation, third generation, what are short acting, what are long acting, all these things you have to remember. Allow to give your attendance. If anybody any doubt, you can send me message or ask me. Okay, I will send you the material. You go thoroughly. Any doubts, you can ask me. Allow to give your attendance. Okay, we will conclude the today's class. So you read thoroughly and ask on next class.